This is a case of simultaneous Intacs and Verisyse Phakic intraocular lens implantation. The center of the cornea is marked, as is the incision site, which is placed along the steep axis. Phakimetry is done at the incision site, and the incision depth is set at approximately 70% of the peripheral phakimetry. Dissection is initially carried out with a Sinskey hook, and then the lamellar dissection is then continued with increasingly larger pocketing hooks. The largest pocketing hook is then inserted into the incision and the channel dissector is then inserted underneath it and rotated to create the inferior Intacs channel. The same process is then done to create the superior channel. The vacuum centering guide guides this entire process. The vacuum is released, and then attention is then turned towards the Verisyse lens implantation. A temporal 6 mm scleral tunnel is created, and a keratome is used to enter the anterior chamber. The Verisyse lens is then introduced into the anterior chamber using the gooseneck forceps. Again, the gooseneck forceps is used to stabilize the lens, while the inclination needle is used to inclinate the iris through a paracentesis wound created adjacent to the scleral tunnel. The same process is done with the inferior inclination site. The temporal wound is then closed and attention is turned towards inserting the Intacs segments. Here the superior segment is carefully introduced into the superior channel. The same process is done with the inferior Intacs segment. A single 10-0 nylon interrupted suture is used to close the incision site. And that concludes the case.